The pandemic is putting health front and center for so many of us right now, especially our mental health. Good afternoon, I'm Kelly Eckerman. Laura has the day off. In Johnson County, Kansas, one person dies by suicide every 4 days. And while the pandemic is moving many mental health services online, groups are seeing some positive results. KMBC9's Bianca Beltran has the story first at 4.
Suicide can be difficult to talk about, but mental health experts say that conversations about it can help save lives.
We have really worked hard as a community to come together and do a few really essential interventions that has actually resulted in a 20% decrease over last year.
In Johnson County, the Mental Health Center director points to the teen-led Zero Reasons Why campaign and says there are fewer young people dying by suicide this year.
Sharing your story is the first step to recovery.
He says parents play an important role in addressing the impact COVID-19 has on their children's mental health.
And I think if we empower people, then we're helping young people become more able to cope with situations. They become more resilient. And what we do is end up having kids that no matter what they face in their lives, they're going to be able to overcome this.
Anyone can sign up for mental health first aid training.
When we come in contact with an individual that maybe needs support, it not only teaches us how to interact with someone or what to say and what not to say, but it also gives us the resources so that we know where to help someone get connected.
Whether it's peers, parents, or counselors, there is help. It starts with a conversation. Bianca Beltran, KMBC 9 News.
Anyone experiencing a mental health crisis or witnessing one is urged to call the Johnson County Mental Health Crisis Line. That's 913-268-0156, or the National Suicide Prevention Hotline, 800-273-8255. Across the state line in Kansas City, Mayor Quinton Lucas is announcing $1 million investment in youth mental health. Green Light Fund Kansas City is giving $1.7 million to help children impacted by violence and trauma. The program will target teens in the Hickman Mills School District and get them connected with counselors and mentors. Turning to the pandemic now, both Kansas and Missouri are reporting new numbers today. Since Friday, Kansas has seen more than 1,500 new cases. In Missouri, there have been more than 1,300 new cases since Sunday. The positivity rates in both states are trending down. Kansas is at 13.8%. Missouri is at 11.2%. The national average is at 5%. 2 people in the Sedalia School District have tested positive for the coronavirus. One of them is connected to Smith's Cotton High School and the other to Parkview Elementary. The district has not said whether the cases are students, teachers, or staff. Both people are quarantined at home, and the district says there is no high-risk exposure, meaning no one else needs to be quarantined. Some parents say it's difficult for their children to keep their masks clean and dry throughout the school day, especially while in the classroom. Doctors at the University of Kansas Health System say even a wet mask, though, can still provide protection from the virus.
If you're worried about increased risk of infection, that's true. But again, masks are more protecting everybody else, especially cloth masks, not as much protecting you. And a cloth mask can still have some barrier protection from things going on. It's not as great as when it's dry, but they'll have some protection even still when it's wet.
Doctors say it's important to monitor for any facial rashes or irritation that might develop. If mask cleanliness continues to be an issue, packing multiple masks for the school day is recommended as well. There's more evidence now showing vitamin D is important when it comes to surviving a case of COVID-19. In fact, a new study shows the risk of severe infection could almost double in those who are vitamin D deficient. A specialist from St. Luke's explains what that could mean to you.
You get vitamin D naturally from sunlight and certain foods, but 3/4 of us don't get enough. When you're vitamin D deficient, you're more susceptible to infections. St. Luke's cardiologist Dr. James O'Keefe, who has studied the effects of vitamin D for years, says it makes sense to watch your levels during this pandemic.
If you're vitamin D deficient, you're more likely to come down with COVID. And number two, that if you're vitamin D deficient, especially if you're really deficient, you're much more likely to have a severe course, end up, in respiratory failure, on a ventilator, dying from it, sort of thing.
Dr. O'Keefe says he takes vitamin D supplements himself and recommends them to his patients, but adds it's a good idea to get a blood test first to know exactly how much to take.
That being said, most people need to take about 2,000 units of vitamin D3 to keep their vitamin D levels in the normal range. So that's a reasonable thing to do for people these days.
Some people have a higher risk of not getting enough vitamin D, especially those with dark skin and adults over age 65. When it comes to COVID-19, there's still a lot more research to be done.
In my opinion, there's never been a more important time to keep your vitamin D3 levels normal, just because of this dangerous virus out there.
Now remember, taking vitamin D does not take the place of masks or social distancing, but it could protect you from a more severe case if you are infected. Dr. O'Keefe also recommends getting outside more while the weather's nice. Get some of that natural vitamin D from the sun. Jackson County will offer COVID-19 testing every day this week. Free testing will take place from 10 to 2 at a different test site each day. You do not need to be showing symptoms to get tested. Walk-ins are welcome, but appointments are recommended. For locations and to register, visit the Jackson County Health Department website.